Good afternoon, Alameda County RCFE and ARF team members. We are so glad to have you today. We haven't met in a month and we are back here today with some updated guidance from Department of Social Services. So I want to remind everyone, we'll provide all of the slides and the recording to anyone who's registered the day following the event. So tomorrow we'll send that out. Please share with any of your colleagues and peers who work in the field. We really want them to have this information. And with that, I'm going to turn it over to our fearless leader, David.
Great. Thank you, Nicole. And thanks everybody for taking time out of your busy Monday to join us on our monthly webinar series. Let's go ahead and get started because there are some things that have changed and we got a new pin released just an hour and a half ago. So we included that in our update for you as well. So things continue to go well from an outbreak standpoint here in Alameda County. As you can see, our lines are flat. They've remained flat. Today, we have just 10 long-term care facilities that we're supporting with open cases. This is a pretty low number for us. We had a high of serving 167 long-term care facilities. Way back in December, which seems like a year ago now. So this is great. We don't want to let our guard down, and we still want to be pretty vigilant on making sure that any of our residents or staff who haven't been vaccinated, that we make the effort to get them vaccinated now. So in terms of accessing the vaccine for your residents and staff, here's just an update. Certainly always be requesting that the acute hospital or the skilled nursing facility administer the vaccine before admission, preferably J&J, but if they prefer Moderna or Pfizer, that's fine. You should be checking with your local contracted pharmacy. They very likely have vaccine supply now. If they are indicating to you that they'd prefer to wait until you have 5 or 10 residents, enough residents for a whole vial before they come over or before they help you with vaccine access, you should ask them to reconsider that. After all, there is plenty of vaccine now in the community, and the CDC has put out guidance that there should be no reason for waiting for an exact number of vaccine recipients to match what's in the vial. If only 2 of your residents in a Moderna vial of 10 needed to be vaccinated, according to the CDC, they should be vaccinated. And if 8 doses were wasted, it would still be worth it, according to the CDC. So make sure that your current pharmacy is in alignment with current CDC guidance related to accessing the vaccine. If you need any help for your staff or residents, or just need any help talking through how to access the vaccine, you can call our vaccine helpline at 510-208-4VAX or 4VAX. And only for the next 2 weeks, we have access to skilled nursing pharmacy who can come out and provide you and your residents and staff access to a mobile vaccine clinic that will come right to your door. So skilled nursing pharmacy has served, 65 long-term care facilities with clinics so far. They've completed 57, and they've administered almost 700 doses. So if you need a vaccine clinic, when you get these slides, please click on this link that you see on this slide, number 4, and we'll make sure to schedule SMP to come to your facility. However, it's very likely that you have access to the vaccine through your local pharmacy, but let us know if you need a clinic. So we're loving skilled nursing pharmacy. They've done a great job for us, but they'll only be able to serve Alameda County facilities for the next 2 weeks. After that, we'll have less access to these mobile vaccine services. However, do keep in touch with us. We're here to help you gain access to the vaccine. And if need be, we'll find a way to get a clinic to your facility if you need it. So skilled nursing facility, as I know most of you aren't skilled nursing facilities, but skilled nursing facilities have just been required by CMS to start publicly reporting their staff and resident vaccination rates. And beginning on May 21st, the public will be able to see every skilled nursing facility's vaccination rates of their residents and staff. I alert you to this because this absolutely could be also a requirement of RCFEs and adult residential facilities. Oftentimes, these are precursors to what will happen next in the assisted living sector of our healthcare system. So I would be very tuned into the likelihood that you will also have to publicly report your vaccination rates. Now, skilled nursing facilities in California are touting very high vaccination rates, but I'm just wondering how high the vaccination rates are in our RCFEs and assisted living and adult residential care facilities. So question for you, please put it in the chat. What percentage of your residents and what percentage of your staff are fully vaccinated? It's really important that you achieve an 85 to 90% vaccination rate. Of course, 100% is even better, but consider that your vaccination rates could be in the public domain. Let us know what they are. Let us know how you're faring in terms of your vaccination rates. That'd be interesting to see. I recently read a story about two different nursing homes who took two different approaches to achieve the same result, which was a very high staff vaccination rate. One very large nursing home in Georgia mandated that all 650 of their staff be vaccinated, and 17 of their staff quit due to that requirement. However, they were able to achieve 95% of their staff being fully vaccinated. Another nursing home in North Carolina decided, instead of mandating that their staff be vaccinated, they decided to pay their staff to be vaccinated. And they offered the staff $1,000 if they became fully vaccinated. And sure enough, they achieved a 95% vaccination rate of their staff. So two different approaches got the same result. But once these vaccines are no longer under emergency use authorization, and if that emergency use authorization is lifted, that paves the way for healthcare providers and systems and employers to mandate that employees be vaccinated. So I would expect that more and more healthcare providers will be mandating the COVID vaccine once the EUA is lifted. But let's take a look to see if anybody put anything in the chat in terms of their vaccination rates. Let's see. Are you seeing anything there, Nicole?
Yeah, we have Maria who says 100% of her staff are vaccinated.
Awesome.
We also have Teresa saying also 100% of her staff are vaccinated, and 12 of 13 residents. Irene is coming in with 100%, and I would love to hear from these folks. Drop it in the chat what they did to incentivize vaccination and make it less scary. Like, how did you? That's amazing. I want to hear what you guys all did.
Sure. Feel free to come off mute if you'd like to, and let us know how you were able to achieve those great results. Maria or anyone? Teresa? No? It's okay if you don't want to. But congratulations, that's excellent, because that just paves the way, of course. Now, when guidance changes, you'll be able to adopt all of it and move ahead and get your communities back to normal. So the question is, when will testing stop, right? When can we stop testing our staff on a surveillance or screening? Well, it's still unknown. And we'll share with you what CMS and the CDC has advised to the states. However, testing right now is still in place, and there's some very valid reasons why it should remain in place. Um, Probably the number one reason is that we're not sure um, how long the vaccine will last. And we're also very clear that the vaccine does not completely protect people. We also are very aware of the variants that are mutating. So there's a number of reasons why testing, especially testing our staff in long-term care facilities, will likely continue. However, the science and the evidence is mounting that the vaccine is not just extremely effective in protecting us against hospitalization and death, but also very effective in preventing us from um, from being infected and then spreading the virus asymptomatically. So there's growing science that fully vaccinated people really can't carry and spread the virus. And as that science grows, certainly confidence grows about the necessity that maybe we don't have to keep testing the vaccinated staff. But we'll see. The state of California is deciding that right now. We know that 50% of the residents and staff who have COVID are asymptomatic. We know that it's really been our savior to aggressively test the staff on a screening basis every single week to find those asymptomatic cases that are lurking and could potentially spread the virus. We've had testing in place for a number of months now. RCFEs, ARFs, other long-term care facilities were all mandated to test their staff every single week by Dr. Moss here in Alameda County as part of a health officer order. And that testing is still in place and required of both vaccinated and unvaccinated staff. Now, you have this really great opportunity if you're an RCFE or you're an assisted living provider, adult residential facility. The state of California is giving you this wonderful opportunity to go through these 4 steps that you see here, and whereby you'll gain access to the state's CLIA number, which will enable you to order and start using the point of care antigen test kits. As you know, there are 2 ways that we can test for COVID. We have the standard PCR test where we're doing the deep swab, sending the specimen to the lab, getting the result back in 24 to 48 hours. Or we also have the point of care antigen test kit where we can swab a resident or staff member, put the swab in a test kit and get a result back in 15 minutes. And the federal government and the state of California and Alameda County really wants all of the RCFEs and assisted living providers to go through these 4 steps, gain access to the CLIA number, order the free test kits through our warehouse, and begin using those test kits, because this point of care antigen testing was a big breakthrough for the skilled nursing facilities when they started using them in terms of preventing and mitigating the spread of COVID. And we need more and more RCFEs to be competent and equipped to use the point of care testing should we have a surge in the fall, or should we have a variant that emerges. You should be well equipped to be using these types of test kits. So I encourage you to go through these 4 steps. Once you go through those 4 steps, then you can come back to this slide and order the free Binax Now point of care antigen test cards through our warehouse that you see at the bottom of this slide. But of course, you can order all sorts of PPE through this link to our warehouse. But the point of care antigen test kits are something that you should really get familiar with. The lesson learned from the pandemic was that slow testing, slow test results led to spread, hospitalizations, and deaths. Fast testing, fast results prevents spread, allows us to effectively cohort, minimizes hospitalization and deaths. So there's a world of difference between being equipped where you control the test and get the result right away, or you're sending it to a lab and hoping you get the result back in a timely manner. So really want you to get equipped with using this. If you have any questions about it, just let me know. So Alameda County recently released this information on May 13th related to false positives. We're getting a lot of questions about false positives, especially in residents who are vaccinated. So, or with staff who are vaccinated. So here's the deal when it comes to someone's thought or suspicion that there's a false positive. So the question is, can I retest? So Alameda County generally recommends against retesting a resident or a staff member with a positive PCR result, even if they were fully vaccinated or unvaccinated and asymptomatic. So we don't really support retesting. Generally speaking, a positive should be treated as a positive, and you should act accordingly. Guessing whether it's a false positive and retesting is not recommended. Fully vaccinated persons can get and transmit COVID-19. An asymptomatic infection, as we discussed, is a well-known driver of the pandemic. We still have moderate levels of the virus in Alameda County, and false positives can occur with any tests, but there's no recommended procedure from the CDC to determine that a result is false, and viral shedding may be intermittent. Therefore, isolation and quarantine requirements still apply. So treat a positive as a positive. Better not to try to play detective to determine or be suspicious of it being a false positive. Just treat a positive as a positive. People have to isolate and quarantine accordingly. And that's all the guidance that we really have around a false positive. You don't want to treat something as a false positive and not quarantine someone only to learn that they truly were positive and shedding the virus. So treat a positive as a positive. All right, so this next slide just relates to an AFL that came out for all facilities, and it's basically just advising you that the state warehouse of PPE supplies is overflowing, and each one of you now has the opportunity before June 15th to go and request a 30-day sustainment supply of PPE. And so here I just kind of copied that AFL to alert you to this date of June 15th that you'll have to order your 30-day supply of PPE to the state. So once again, when you get this slide deck, please feel free to click on these links here and stock up on your PPE. Make sure, a 45-day supply is really what you should be striving for, but go ahead and take advantage of this offering by CDPH and grab whatever PPE you need to achieve that 45 days. I think I'll pause there for a second and see if there's anything in the chat box, Nicole, or any questions that anyone might have.
I just want to circle back to we were talking about vaccine acceptance rate among staff, and Teresa shares that they really explained that the symptoms they were going to have from the vaccine was a lot better than passing away from COVID, which I think is the best thing. You might still get COVID, but you're not going to die. So I appreciate that. We don't have any other comments in the chat, so I want to encourage folks to add questions or concerns in there. Remember, I know we haven't gathered in a month, but this is a judgment-free zone, so you can put anything in there, and probably other people have the same question. So feel free to be candid.
Great. Yeah, thank you. And thank you, Teresa, too, for sharing that. Without a doubt, those leaders that really reached out one-on-one to their staff, had group meetings, got physicians or nurse practitioners involved to talk to staff, did have very good success in achieving a high vaccination rate. So good for you. So we still have some risk, right? We still have to mitigate the risk. Our residents and staff are still the most vulnerable. Because we were the first to get vaccinated, we'll be the first to learn how long the vaccine lasts. So we need to stay on heightened alert. I would say our risk right now is somewhere in the middle. But we must remain vigilant by adhering to the core principles of COVID-19 infection prevention. Please keep your screening processes in place. Make sure they're tight. Make sure you're asking for people's vaccination cards, test results. Remain vigilant with screening at the door. Remain vigilant with hand hygiene. Our hands are how viruses are spread. Make sure that your staff are not confused about all they're hearing about taking off masks. When it comes to a healthcare setting, they're still required to wear masks. So make sure your staff are still using surgical masks, and they're wearing them at all times within your facility. In addition, social and physical distancing is also really critical, as well as accurate signage, cleaning and disinfecting, getting all the PPE you need right now that there's a lull and there's plenty in the supply chain, really stocking up, purchasing a new shed if need be in order to stock up. Making sure you're rethinking how you might cohort in the future, taking advantage of point of care antigen testing to allow you to more effectively cohort with timely test results. So there's been a number of pins that have come out since we last got together. The one that came out right after we met, 2123, provides updated quarantine and isolation guidance. Pin 2126 simply announces an informational call this Friday at 1 o'clock. So this Friday at 1 o'clock, please consider joining the CDSS call. That call will primarily focus on pin 2117-2. So just this morning, pin 2117-2 was released. But prior to that, after the last time we met, pin 2117 was released. So these changes are coming fast and furious, but please do put it on your calendar to tune into the CDSS webinar this Friday at 1. And at that webinar, they'll go in depth on pin 2117.2. So pin 2117 has now been updated 3 times in less than 2 months. So things are changing really, really fast here. So here's what 2117.2 says in regards to indoor and in-room visitation. Licensees should allow indoor visitation, including in-room visitation, at all times for all residents, regardless of their vaccination status of the resident or the visitor. So all times for all residents, regardless of their vaccination status. Circumstances where you wouldn't allow indoor in-room visitation would be residents who are confirmed positive or residents who are in quarantine. For folks who are positive or in quarantine, the only indoor in-room visitation that they're going to have would be for those compassionate care visits. So a fully vaccinated visitor and a fully vaccinated resident can choose to have close contact, including touch, and do not need to wear face coverings while they're alone during the visit. A fully vaccinated visitor should wear a full-fitting face covering and physically distance from all other individuals when they're walking through your facility. If a resident is fully vaccinated and the visitor's not fully vaccinated, the resident can choose to have close contact, including touch with the visitor, while both are wearing masks, whether indoors or outdoors. So there can be physical touching between a vaccinated resident and a visitor who's not fully vaccinated, as long as they wear masks. And when either the resident or the visitor is not fully vaccinated, the safest approach is for them to keep their distance, wear masks, and probably visit outside. When it comes to communal dinings and activities, if everyone in the dining room is fully vaccinated, then the residents don't have to wear masks and they don't have to socially distance. But if just one unvaccinated resident is in the dining room or in the activity, then everybody would need to socially distance and everybody would need to wear masks. This pin emphasizes that you cannot keep unvaccinated residents out of the dining room or out of the activity. That is their right to participate. And you can't separate them based on their vaccination status. So even though an unvaccinated resident, if they were to be in the dining room or activity, would kind of, I don't know, ruin the party, you cannot discriminate against them and tell them that they can't come into the dining room or activity. If there's any comments or questions about any of this, I know it's a lot to digest, so feel free to either come off mute or put your question in the chat. So for residents coming back from an outing, if the resident indicates during screening that they didn't take precautionary measures, they didn't wear a face covering, they didn't physically distance, and they maybe went to a crowded restaurant where no one was wearing masks, the pin indicates that you still don't need to require them to quarantine unless for sure you know that they had contact with someone who tested positive. So that's what the pin says. So basically a resident could say, yes, I went out, I ate at 3 restaurants, I went dancing at 3 bars, never wore a mask, and here I am back and ready to come back into your community. This pin says you can't make them quarantine. However, you would be wise to get them tested as soon as you could. And of course, if you had the point of care antigen test kits, you'd probably test the resident right then and there. Regarding new admissions, both vaccinated and unvaccinated new admissions don't have to quarantine on admission if they've been tested in the last 2 days and their test is negative. And of course, if you know that they've had no known exposures. So again, new admissions don't have to quarantine. whether they're vaccinated or not, as long as you know that they haven't had an exposure and as long as they have a negative test result within the last 48 hours prior to admission. I'll just pause to see if there's any questions in the chat box.
I don't see any, but we do have a Q&A.
Okay.
So it says, if all staff are fully vaccinated, do they need to continue to wear a mask in the break room?
Well, it's the same. If they're all fully vaccinated and they're in the break room, they don't have to socially distance and they don't have to wear a mask. But if just one unvaccinated staff member showed up, then they'd have to spread out and wear a mask. But in your situation, if all the staff are vaccinated while they're in the break room, they don't need to wear masks or socially distance. But they would still need to wear their mask, of course, when they're walking around the facility as source control. Good question. And so a lot of the changes that were reflected in PIN 2117.2 were also reflected in the guidance from the Centers for Medicare and Medicaid Services to long-term care facilities related to testing, visitation, and activities. And pretty much what we see in the PIN is what we saw in terms of guidance from CMS. And here, related to our last discussion, is the point that if the staff are fully vaccinated, they can dine and socialize together. They can have an in-person meeting, and they don't have to have source control or physical distancing in the break room and meeting if they're all fully vaccinated.
But we have a good question here, which is sort of a merging of communal dining and visiting. Yeah. So can a family member come in and share a meal in the dining room with residents, both their family member and others, if they are vaccinated, all the residents are vaccinated?
That's such a good question, but it's not addressed in any of the pins. Mm-hmm. My guess is they would say no. However, that's such a good question. I think you should ask it on Friday to CDSS. Mm-hmm. My guess would be no, because they keep emphasizing, in-room is in-room visitation, indoor is usually communal space, but away from others, and then outdoor, but they never really talk about joining a resident for a meal. But that's a good question, not sure.
And I just want to remind everyone, when we send out the recording and the slides tomorrow, we will include links to the pins that we talked about today, one of them being the call that's going to come up this week. So if you're like, gosh, where are you getting these pins? We'll provide you that information. And I'll also include how you can sign up directly to get pins to ensure that you're getting all the updated information that David's putting out there. They send it out on a daily basis. So we'll provide all that to you in the follow-up email.
Thanks, Nicole. So one thing that wasn't addressed in the PIN that is still being kind of hashed out is related to the testing of healthcare personnel, or HCP, healthcare personnel, after an exposure or during an outbreak, or just as routine testing. So here, clearly CMS and CDC that indicate that regardless of someone's vaccination status, if they've been exposed, they should be tested. If they're in the middle of an outbreak and we're in response testing, they get tested. However, the CDC is recommending that vaccinated staff don't need to participate in weekly testing. Only the unvaccinated would need to participate in weekly testing. So for example, the folks on the call that indicated 100% of their staff are fully vaccinated. Right now, I imagine you're testing half those staff every week. If CDSS were to accept this guidance, then you would be able to stop testing. However, Alameda County is really the one that put this testing requirement in place. So you'd have to wait for Alameda County to rescind the health officer order that requires you to test your staff. Now, right now, Dr. Moss is considering rescinding that health officer order if CDSS comes out in support of stopping the testing, the routine testing of vaccinated staff. But for right now, you're still required to do that testing. But in the next few weeks, vaccinated staff very likely will not have to go through routine testing every week anymore. Only the unvaccinated staff would have to go through that routine testing. So, as you know, in all these cases, I'm giving you a little bit of a precursor of what CDC said, and then CDPH and CDSS weigh in and either align with CDC or they become more restrictive than CDC. And then after the state weighs in, then Alameda County weighs in and determines whether or not we'll align with CDSS or CDPH or will be more restrictive than the state. So just be patient. I'm giving you just a heads up of what might be coming down the road in terms of testing of your staff. Here we already covered this, so the PIN matches up exactly with the CDC and CMS guidance that came out in late April. So I'll skip that. We covered testing. I want to encourage you to continue with those core principles for now. June 15th looks like a potential day where lots of things can get back to normal. But for you and your residents and your staff, be considerate that you might want to proceed slowly in what you stop doing in terms of preventing and mitigation strategies. Consider maybe being the last one to stop testing, the last one to ease up on face coverings. This is a very tricky disease where we tend to be moving really quickly in terms of easing restrictions and requirements. And I would hate for us to move too quickly. So just be considerate that at the end of the day, you are in control of what kind of restrictions and requirements related to COVID that you will impose on your community. And it doesn't hurt you to move slowly and be cautious, especially after all that we've been through. So I'll pause now and turn it over to Nicole for her insights and comments.
Oh, thank you, David. But I don't have any official announcements today other than to remind you that my staff are being as vigilant as you and your staff, and we are still testing weekly, and they have been vaccinated, and we're still, of course, wearing, at the very least, a mask and a face shield. But if they're in a quarantine zone, they're, of course, also wearing a gown. So just want to assure you we're undertaking really significant safety protocols in addition to daily screening. So if you ever have any questions, please let me know. I want to thank you all for your continued vigilance. As David said, this is a tricky disease and we don't know everything yet. We'll bring you everything as soon as we feel like we have a sense of it, or even give you a heads up. But know that just be vigilant and continue to talk to your staff and communicate regularly with families and residents. And I think that we will find ourselves on the other side of this sooner rather than later if we are vigilant and if we are really maintaining protocol. So thank you so much, everyone.
Any last questions or comments from anybody? If not, we'll get together in about another 4 weeks and we'll bring you updates at that time. If there's significant changes, then we can always schedule something sooner, but that will be the plan. Thank you so much for all you're doing to keep your residents and staff safe.